A trained healthcare worker will interpret the reaction based on the size of induration. The induration, or hardness, of the test is read from left to right, not up and down. Redness at the injection site is not included in the reading of the test. First, inspect the injection site, observing for induration. Second, palpate using your fingertips to find margins of induration. Third, mark the induration with a pen using your fingertip as a guide of where it begins and ends. Then, use a TB skin test ruler to measure the area. If no induration is present, you would document the findings as 0 millimeters. Interpretation of the TB skin test depends on the measurement of induration, the person's risk of being infected, and progression to disease if infected. Greater than 5 millimeters of induration is considered positive for people living with HIV infection, recent contact to a person with infectious TB disease, people with abnormal chest X-ray findings, people with organ transplants, or other immunosuppressed people. 10 millimeters or more is considered positive for people born in countries where TB disease is common, people who use illicit substances, TB laboratory workers, people who live in or work in high-risk congregate settings, people with certain medical conditions that place them at risk, children younger than 5 years of age, and infants, children, and adolescents exposed to adults in high-risk categories. Induration of 15 millimeters or more is considered positive for people with no medical or epidemiologic TB risk factors. North Carolina law mandates the reporting of positive TB tests to the local health department. Once a positive TB test result is received, or if TB disease is suspected, reports should be made to Catawba County Public Health communicable disease staff via fax or telephone within 24 hours. The communicable disease staff are available as a resource to community providers for any TB-related questions. Communicable disease staff will contact the patient and schedule an appointment where the nurse will obtain a medical history, chest X-ray, and sputum samples if indicated. Services provided, including anti-tubercular medications, are at no cost to the patient.